Well, we had a really very exciting morning. It was a live stream as well from all over the world. There's a great group, Sandra Turner with Australia and Katie Wakeham here, deciding with so many groups around the world, from the Americans, about how we should have a a World Radiotherapy Awareness Day, and the planning for that and what should be included and how that could help. We had a lovely video of all the voices from across the world, advocacy, which was great and really motivated us. And then we had a lovely Global Coalition for Radiotherapy 9-panel discussion. We're working on an essentials document at the moment that should fit with national cancer plans. That next level down of what would radiotherapy look like in a country, what is good, what needs to be done, and then where is the value for that, and then next, how do we use implementation science to actually help us make sure we're doing some value. We had some great talks from the ICON group in Australia, how they have got things regulated, got planning down to sort of very fast times, how they've helped China, all these sorts of things by good technology. We heard from the physicist in Toronto, France, talking about AI and how that's going to help with our planning. Radiotherapy is a very technical subject. We need to be thinking now about what it's going to look like 5 years and planning for 5 years' time, which would be fantastic. We heard from industry, we heard from Varian and Electa and Accuray and Amethyst, all these new developments they're doing and how we can improve things. We heard from Katie Spencer about data. She's the lead in the UK for analysis of data. Radiotherapy data you can get straight off machines, and it's really important. Again, data is king. So huge amount of great discussion and great. We heard from some middle and lower income countries about solutions they've had in radiotherapy and the need. And actually, one of them, a very good answer to a question is, how do you get good radiotherapy into countries? Because it is the bedrock of your cancer. Once you solve radiotherapy, you solve a lot of problems with diagnostics, with internet access, transport, engineering, all these type of things. And as he said, you start with, you've got to have a national cancer plan, which was really important there. And it was great in the audience. We heard from a gentleman telling us about Liberia, that cancer wasn't prioritised there. We heard from other people where they can't get spare parts in. And I must say, it was very sobering hearing from around the world. On the Monday, we'd heard from the Senegal region, where the conflict there, radiotherapy you have to travel to. If it's too dangerous to travel, then you're not going to get any treatment, and that is going to stop your access. We heard on the Monday about conflict in areas, Lebanon and Gaza, where in Gaza, they haven't got morphine yet. So radiotherapy there may help, but they can't travel across Israel. Lebanon, where some centers are being bombed now. So there is such a need, and it's so important to share this information about radiotherapy, because radiotherapy is quite a geeky subject. It's got its own issues about the high technical side and the workforce. And I think if we can share information about how to deal with conflict, how to introduce it effectively in countries, and make sure we actually get this accessible. 38 countries in the world do not have access to radiotherapy, and yet it is needed in 50% of cancer patients and it needed in 40% of cures. And I think we have to listen to what's happening. Cervical cancer is still a big problem. And of course, if we can get HPV vaccines in 15, 20 years, there won't be any cervical cancer. But we're not being successful getting the HPV vaccines in everywhere yet. And also, we've got that lag time. So we've got to be treating it now. So we've got to really upfront and address these really critical issues. And radiotherapy's usually been in the background, and perhaps people haven't understood it as well, or it's a technical note at the end of plans, where it's really got to be upfront. And there are so many solutions, and it was so wonderful seeing the Global Coalition bring the whole world together in their thinking about what we need, because I think together we can solve a lot of these issues. And particularly with industry, there are not just our partners, that they're friends, because they have a lot of the technical solutions and they're working really hard. So it was a great day. Glad to see radiotherapy right up there now in the forefront as well. It will be economically very effective to do this in so many ways.